Hi, my name is Christina Gomez, and I'm a nursing student at UT El Paso, and I'm going to be doing a presentation today on asthma. Asthma is an inflammatory disorder of the airways. It causes narrowing, swelling, and produces mucus. Asthma can either be a slight nuisance or a life-threatening disorder. There is no cure, but it can be managed. Asthma can change, so it needs to be monitored, and treatments can be adjusted. The first picture is of a normal airway. The second picture in the middle is an asthmatic airway. You notice some swelling and some tightness. And the third picture is an asthmatic airway during an asthma attack. You notice the extra swelling and the increased mucus in the middle. Asthma can have different types, but the body response is similar. It can be exercise-induced, which is worse with cold and dry air climates, occupationally induced, where you have chemical irritants, or allergy-induced with pollen, mold, pet dander. The prevalence of asthma is that it's the most common chronic disease globally, and it affects 300 million people worldwide. Asthma can be present at any age, but 3 years old is the peak age. In childhood, it affects more males than females, but as adults, the ratios tend to stabilize out. Deaths from asthma are uncommon. Signs and symptoms of asthma are coughing, shortness of breath, chest tightness, chest pain, difficulty breathing. Worsening signs you want to watch out for are increasing attacks, increased difficulty breathing, which you can verify with a peak flow meter that we'll cover here in a moment, and using inhaler more frequently are signs that you'll want to watch out for that shows your asthma might be getting worse. Risk factors for asthma are family history, an allergic condition, being overweight, a smoker, viral infection, second-hand smoke exposure, occupational triggers, or respiratory infections. Diagnosis and monitoring are done by a physical assessment, measuring lung function. One way to measure lung function is with this peak flow meter. You have the asthmatic blow into the bottom chamber and see what their lung capacity is. And if it reaches between the yellow, they might need a treatment, a rescue inhaler. Below the red line here would signify that there's a crisis below that red line. If you're above the green, then it shows that you're doing okay. The methacholine challenge is a drug that causes a mild constriction of the airway to trigger asthma. So if you react to this challenge, it's probable that you do have asthma. The nitric oxide test is that inflammation. When you have inflammation, it causes high nitric oxide levels. So if you have high nitric oxide levels, you have inflammation, which can be an indicator of asthma. You can also have imaging tests done in addition to your physical assessment, which will include chest x-rays and CT. You can also have allergy tests that will identify your triggers for your asthma. Medications for asthma are inhaled corticosteroids such as Flonase or Pulmicort. It's an anti-inflammatory inhaler that's safe for long-term daily use. You can also have medications such as Singulair, which is an anti-inflammatory oral medication. Advair and Symbicort are combination inhalers. They relax the airway, smooth muscle cells, and they inhibit inflammatory cells. These are long-acting beta agonists, which may increase the risk for an asthma attack. So you need to have your usage monitored by your doctor. Short-term use medications would be something such as Provair or Ventolin. Those are bronchodilators for quick relief if you're having an asthma attack. Oral corticosteroids can also be used short term, such as prednisone and methylprednisone. That's a steroid oral medication. They relieve airway inflammation. Asthma should be managed with your long-term use medications. If you notice that you're increasing your short-term use medications, you may need to notify your doctor to adjust your action asthma plan. This is an example of an inhaler with a spacer or a chamber. The medication is here in the end of the inhaler, and you actually put this section up to your mouth and you inhale while pushing here and to get your medication dose. The chamber is believed to give a more concentrated effect of the medication, but that's an example of a prescribed inhaler. Health promotion for asthmatic is that you want to follow your action asthma plan, which is initiated by your healthcare team. It could be a pulmonologist, a doctor, a pharmacy. You want to obtain your yearly flu and pneumonia vaccines. You want to identify and avoid asthma triggers. You want to monitor your breathing with your peak flow meter. You want to identify and treat attacks early and take all your medication as prescribed. You also always want to keep your rescue inhaler available if you have an asthma attack. Thank you for your time. I hope this was informative for you.